my name is Caroline, I'm a physiotherapist. If you're breathless for whatever reason, it can be very, very scary and frightening for you and for everybody around you. Today we're going to think about some tips to help you relieve your breathlessness. You can be breathless for a variety of reasons. You could have asthma, chronic obstructive airways disease, COVID-19, a chest infection, pneumonia, but for whatever reason you're breathless and we need to think about that. Some people think their lungs are up in their throat and in their neck, when actually your lungs are right deep down through your chest, all the way down into your lower ribs if you have a feel where they are all the way down there. So recognizing where your lungs actually are can help a lot in helping you fill them up with lots of oxygen and lots of air, which can go into your bloodstream and help you help with your breathlessness. So if you want to get a strap or a belt and place it around your chest, sometimes that can help remind you just where your ribs and your lungs are. So place it right down the lower ribs there, and it's a good idea to cross it in front so you can give yourself a little bit of resistance and feel the expansion. Nice wide knees, relax your shoulders, try not to breathe into your upper airways because then you can overuse your accessory muscles and your neck muscles, which makes you more tired, uses more oxygen, and makes you more breathless. So drop your shoulder blades down away from your ears and taking a big breath in and out. Breathing wide and full, right into the back of your ribs, right into where that strap is behind you. And again, breathing in and out. So getting the oxygen deep inside really helps. The other thing some people find good is to slow their breathing down and to try and count to make that happen. So if we try and breathe in for 3 and out for 3. Breathing in, 2, 3, out, 2, 3. In, 2, 3, out, 2, 3. Let's try and expand that to 5. Okay, breathing in, 2, 3, 4, 5. Out, 2, 3, 4, 5. And in, 2, 3, 4, 5. Out, 2, 3, 4, 5. When you're breathing out, if you try and blow out through pursed lips, some people find that pursed lips helps the pressures in your airways stay open. So breathing in, 2, 3, 4, 5. Out. Breathe out for as long and as full as you can, because the more you breathe out, the more you can then breathe in afterwards. Pretend you're blowing up a balloon or blowing out a candle. Breathing in. If you've got children or anybody really, maybe try and let them blow out through a straw to get the idea. Breathing in, breathing out. It can be a fun way to slow down the exhalation and then more air can come in afterwards. So breathing in, breathing out. Does help. The other thing some people find is changing their position. So a little forwards lean position can be quite nice. It opens up the intercostals in the chest, lets the diaphragm drop forwards and lets the tummy sink forwards. And breathing in. So we've looked at expanding our lungs down deep, low down into our lungs. We've thought about our positioning, maybe leaning forward is a good place to be. We thought about slowing down our pattern of breathing. We've thought about breathing deep, deep, deep in and all the way out, taking it all the way in wide and full and all the way out, maybe counting the breaths so we can slightly get longer breaths in and longer breaths out, becoming aware of the space in between our breaths. Pursed breathing, breathing out through pursed lips to blow a candle out, or to blow up a balloon, or to blow through a water with a straw. That's quite a nice technique. Another thing that's quite nice is coughing effectively and efficiently. If you feel a cough, some people cough, that's a cough in the upper airway and is not very effective at clearing phlegm and sputum that might be pooling deep down. You need a deeper huff for that to get deep into your lungs. So if I demonstrate, we're going to take a breath in. That is a more effective cough, clearing any secretions that might be building up in your chest. It's always better to do a huff after a couple of deep, wide, full breaths. So here we go. We're going to breathe in. People find it effective to pretend they're breathing on a mirror, so creating some condensation on a mirror is good for children to practice. You know you're doing it right when you've got some condensation on your mirror. Another nice thing to do is to let people have some albus oil or some other linctus or some tiger balm onto a tissue, and that can help open up their airways. Just breathing in through the nose, out through the mouth. Another position to sit in is if you want to turn around on your chair, come around and sit forwards on your chair with your hands in front. That can again help your tummy just drop forward, and it's a nice position to relax in. If you're trying to go to sleep or have a rest, it's a good idea to stack a lot of pillows and cushions up on the bed or on the sofa so that you're in an inclined position with your head above your hips. So that again helps your lungs expand and helps your tummy relax. Side lying is best because then it helps each lung expand equally. Well, I hope today's been helpful to you. If you feel that you're still out of breath and can't breathe after all our top tips today, then please phone your doctor